Hi, I'm Dr. Murali Mohan, and I'm with Dr. Ravi Chandra. Both of us are from the Department of Medicine and Pulmonology at Narayana, the Mazumdar Shaw Medical Center. Today, we'll be discussing with Dr. Ravi Chandra the problems that we face with the newly discovered coronavirus, which has made waves all around the country and the world, with people worried about this problem. So we're here to clear up doubts and make a few suggestions as to how to manage this problem and how to prevent oneself from getting it. So Dr. Ravi, what is happening with the coronavirus? What is this virus and how does it affect human beings?
Right, sir. Thank you for that introduction, sir. And so it's a very important question. What is the coronavirus? And let me begin with saying this, that it's a new old virus, meaning this virus is not new to us. It has always been around. This is a virus that has been for decades and centuries been causing what we refer to as the common cold. But it's new because this virus looks like it has undergone a mutation. And viruses very commonly undergo mutation. And when they undergo a mutation, they can become either more powerful and more virulent. They may be able to spread more easily from person to person, or they may become less powerful and less virulent and spread slower or not even spread from person to person. We are obviously not worried about the latter, but we are worried about the former, when viruses which are already known to us, which already exist in our community, mutate and become more powerful, then this means that they spread far more easily. So essentially, the coronavirus is the same virus that has been causing the common cold for centuries. This time, it looks like it has become a little more powerful. Since we are at the very beginning of this outbreak, I think it is too premature to speculate upon how powerful it really is. Any virus, when it mutates and when it starts off a new endemic or an epidemic, or hopefully not, but probably a pandemic, it will invariably cause some morbidity and mortality. I think we should be very careful not to speculate about how powerful a virus is or how dangerous a virus is based on the initial few reports. Rather, wait for the whole picture to evolve so that we will know exactly what we are dealing with.
So when you say endemic, you mean it's restricted to one place, an epidemic spreads over multiple areas, and a pandemic spreads across the whole world. Is that large populations? Is that right?
Exactly, sir. So endemics are diseases which are restricted to one region. These regions are usually have physical barriers, or there may be some demographic constraints which restrict the diseases to those regions. An epidemic is a disease which spreads over a larger area, covers maybe several countries. And pandemic is a disease which becomes sufficiently powerful, mobile, virulent, whatever we may call it in either layperson terms or medical terms, but sufficiently virulent for it to be able to spread across the entire world and probably very rapidly.
So this coronavirus, the novel coronavirus, has the potential to become a pandemic, but is certainly not one yet.
That's right, sir. I think we can say that when this problem began, it was clearly endemic. It was restricted to one or more cities in central China. But we also know that this is probably spreading very easily because very quickly, within a matter of a month, we have been able to pick up new cases across the entire China. New cases have appeared in a large number of countries in Southeast Asia, and purely based on this information that we have, that it is spreading fairly fast between individuals within the country and from country to country, I think it is safe to speculate that this has a potential to become a pandemic.
And when you say virulence, you're talking about how potent it is to cause damage. And you said morbidity and mortality. This is disease occurring in people and death. So what do we know about how virulent and how likely it is to cause morbidity and mortality?
Yes, sir, that's right. So the virulence of an organism, be it a virus, be it a bacteria, basically refers to how easily it can cause damage to the tissues and therefore the individual. And the morbidity and the mortality refers to the end effects. So does it pass away with a mere sore throat, or does it cause very severe illness like breathing difficulty and the requirement to be hospitalized, the requirement of oxygen, etc.? So again, I think it's a little early to speculate about how virulent this particular virus is. Now, in the early stages of any infection, when it starts spreading, we should understand that the mutation that has occurred and the spread that is happening in naive population. In other words, people in that region, and of course in the rest of the world, have not been exposed to this new virus ever. And therefore, it is expected to cause some problems. Now, there is one or more statistic that we often try to measure to see how dangerous or how virulent an organism is. And one of them is called the case fatality rate. So in other words, if say 100 people contract this disease, how many people are likely to die because of the direct effects of this disease? So this is a continuously evolving number, as we all know, because in the initial stages, we only know that a few people have this disease, but as we test more and more, we actually start realizing how many more people have this disease. Secondly, how many people have this disease is actually far more than what is apparent to us who come for testing. In other words, people may have a very mild disease and call themselves a sore throat and stay at home and not even go to a hospital. We will never pick up such individuals. Only those with sufficiently severe illness will eventually reach a hospital. That is when the doctors will start speculating that this is probably a new virus. Let us start testing for it. And therefore, the case fatality rate is often an overestimate of what it actually is.
Conversely, the number of cases being reported are an underestimate of the total number of cases.
Exactly, sir. So the number of cases that are reported are usually an underestimate. So I go back to this analogy of the tip of the iceberg. So what we see in a hospital, what we hear about in the community is like the tip of an iceberg, and the rest of the iceberg is usually much, much, much larger below the surface. So there are probably 10 times or even 100 times more the number of cases in the community who are not sufficiently ill or who for whatever reason may not present to a hospital. Only the severe ones come to the hospital, and a fraction of these severe ones who present to the hospital end up becoming very sick, hospitalized, and may probably have a poor outcome. But it's very important not to speculate on those numbers of deaths or the severe disease that we hear about, because that eventually represents probably a very small fraction of the entire caseload in the community.
So can you tell us something about the spectrum of disease that the novel coronavirus causes?
Yes, sir. So like I said, the novel coronavirus is a virus that is known in a different form to us for many decades and probably even centuries. This is a virus that causes the common cold. So essentially, if and when this disease strikes, its symptoms may not be very different from what one would call a common cold or a flu. A sore throat, a mild cough, maybe some fever, some body aches, a little tiredness. On the other hand, if this disease becomes more and more virulent, and if the individual who this disease affects is weaker in some sense of their immunity, then this disease can probably cause a much wider spectrum. Such individuals may present with a rapidly evolving condition. They may have breathing difficulty, they may end up requiring oxygen support, and in the worst cases may even sometimes progress to multi-organ failure. But again, like I said, I reiterate, I think those are probably a very small fraction of the entire load of the disease in the community.
And they could end up needing a ventilator too, apart from just oxygen.
Yes, sir. So in the most severe form, this disease causes severe respiratory failure. And in severe respiratory failure, the lungs fail to oxygenate the blood sufficiently, and therefore they have a requirement to be given a much higher concentration of oxygen than we can by the use of conventional methods like just an oxygen mask or nasal prongs. In such conditions, we resort to the use of ventilators, and we sometimes even go up very, very high on the oxygen concentration and the pressures of oxygen that we give to such individuals.
So how does this virus spread? Human to human? How does it spread?
So I think it's very important here to highlight that in the initial phases of this epidemic, when it started, it was determined by multiple agencies that a sustained human-to-human transmission is occurring with this infection. In other words, a human is now capable of picking up this virus from another individual and passing it on to other individuals. So this is called a sustained human-to-human transmission. A sustained human-to-human transmission is, as common sense tells us, is required for a disease or a virus or a bacteria to become epidemic or a pandemic. So now that we know that it is capable of spreading from human to human, we need to understand how it spreads from individual to individual. This is a respiratory infection, and therefore it is transmitted by respiratory droplets. So any activity that involves the generation of respiratory droplets, say sneezing, coughing, all of these produce small aerosolized particles of our respiratory secretions which remain suspended in the air. These respiratory secretions which are suspended in the air contain the virus particles, and when inhaled by somebody else, can transmit the disease. Also, when somebody coughs or sneezes, these aerosolized particles, which remain suspended for a little while, can slowly settle down on surfaces. Equally, when we cough or when we sneeze, we can sometimes block our cough using our hands, which is the right thing to do. But equally, if we don't sanitize our hands and we handle other objects, we tend to transmit the particles that are present on our hand to such inanimate objects, which if somebody else touches within a specified time frame, they can pick up this infection.
So it can be by both inhalation of the droplets as well as by touch and transfer to the face and nose and mouth.
Exactly, sir.
So knowing these things, how do we prevent this virus from spreading from one person to the other? What advice would you give as far as the prevention of this not picking up this disease goes?
Yes, sir. That's a very, very important question. And before I start answering this question, let me reiterate this, that we still don't know how serious this virus is or is likely to be. And with all the current data, it is appearing that this is probably not any more dangerous than all the recent viruses that have affected us, like H1N1, or say even the SARS virus, or the Middle East Respiratory Syndrome coronavirus. All of these are different viruses which have caused epidemics and pandemics in the last 10 or 15 years. Despite that, despite knowing that this is not any more dangerous at this point of time than these infections which have been caused in the last 10 years, it is a good idea to follow some simple preventive strategies. The simplest of these is to regularly do hand washing. When we handle inanimate objects onto which somebody would have probably coughed, or somebody who's handled this virus in one form or the other has touched, then we tend to pick up that virus. So a simple hand washing will sanitize our hands and prevent transmission to ourselves and to others. It is not a bad idea to use a mask, especially when we are in crowded circumstances. And it is definitely not a bad idea for someone who is already suffering from some respiratory symptoms, say a sore throat or a cough or a cold, to use such a mask, because this will reduce the amount of transmission that they carry out to other individuals before they become asymptomatic and cured.
So you mentioned SARS and the MERS, the Middle East Respiratory Syndrome virus. Is it related to the coronavirus?
Yes, sir. All of these are coronaviruses. So I told you about how the coronavirus is actually nothing but our common cold virus. And over the decades, it has undergone multiple mutations. Now, the previous two mutations that have happened with this virus have produced two diseases which we thought at that point of time had the potential to become epidemic and pandemic. In other words, as a medical community, we have always been aware of the pandemic potential of some viruses, and we have been very well prepared for it. coronavirus is in the previous two mutations produced a virus called the SARS virus, which again originated in China for whatever reason, and the Middle East respiratory syndrome virus, which, as its name suggests, originated in the Middle East. Both of them are coronaviruses, and they are exactly the same as the current, what we refer to as the novel coronavirus 2019, with minor mutations, which make each of these different on their own.
And the MERS and SARS, while they caused a big scare, didn't really end up as being pandemic or even epidemic. They were fairly largely restricted to some areas and didn't cause the problems we expected. So we may have the same kind of epidemic potential not being fulfilled with the novel coronavirus too.
Exactly, sir. So what we need to understand is when the SARS outbreak happened, when the MERS outbreak happened, we were very worried that it would blow out into a pandemic proportion, but it never happened. For whatever reason, these viruses remained fairly restricted within their area of spread, both geographically and with respect to time. So we are definitely hoping that the novel coronavirus also remains fairly localized. And we are hoping that this virus does not spread as extensively as several pandemics that happened, say, at the beginning of the century. Either ways, I think it's a good idea to be prepared for a wide spread. But having said that, I don't think we need to worry much at this point of time.
So really, there's no need to panic. We'll know more clearly in the future is what Dr. Ravi Chandra is telling us. So we need to be cautious. We need to expect things to happen and take all precautions. So apart from protecting yourself using, as you said, hand sanitizers and washing hands regularly, what are the other precautions you'd advise, Dr. Ravi?
So as we know, different diseases have different ways they manifest in different individuals. So it is not merely the virus that matters, but also the individuals who pick up these infections that matter. So I think we should be very, very sensitive to the fact that individuals who have other background medical problems, individuals who have an immunity that is for whatever reason slightly suppressed, individuals who are long-standing diabetics, individuals who have probably undergone transplantation, either kidney transplantation or other solid organ transplantation, individuals who suffer from chronic respiratory problems, so things like asthma and COPD, individuals who are in special requirement settings, such as pregnant mothers, such as very young children and the very old individuals. I think these group of individuals need to take special care. I think we can never overemphasize this fact that they need to take special care for all settings and all kinds of infections, not merely this. But since we have a new outbreak in the community and we really don't know how this outbreak is going to span out, I think it becomes very important for such individuals to more over-emphatically follow these particular preventive measures that we have stated.
So how does one make a diagnosis of coronavirus infection, the novel coronavirus infection?
So there are many ways of making a diagnosis, and I think the most important method is a clinical diagnosis. In other words, from the symptoms and signs, does this person appear to have a coronavirus? Now, this can be a double-edged sword, because with coronavirus and with the current epidemic that is happening, the symptoms or signs are nothing but very, very similar to a regular throat infection. This can play both ways. Individuals who contract a regular throat infection may panic thinking they have coronavirus, and individuals who may actually develop the coronavirus may ignore it thinking it is just a simple throat infection. What is important is to understand that when one is ill, one follows all the necessary precautions which one follows during illness. Keep oneself well hydrated, eat healthy food, get good amount of sleep, and remain in contact with one's local general practitioner, physician, pulmonologist, or whoever one regularly sees to make sure that one is not suffering from what could likely become a more serious infection. The coronavirus infection may just pass off as a simple throat infection, but may become more serious. And therefore, it's a good idea if one thinks one is worsening to be generally in touch with a physician or a general practitioner.
And is there any other form of medication that helps? Is there any treatment for this condition, or is it just watchful expectancy and treat complications when they occur?
I think we have anecdotally always said that the one disease that doesn't have a treatment is the common cold. I think it still applies to the coronavirus infection. We don't have a curative treatment in the form of a medication, but that is not a reason to worry or panic. 99% of the times, these infections just pass off without requiring any treatment. The immune system of the human body is usually sufficient to limit the damage caused by this illness. However, we also have a very active pharmaceutical industry which is constantly on the watch for any disease that has potential to become more and more serious, because if and when it does, we also need medications to treat it. I can say at this point of time that several trials are being conducted into medications which could probably be effective against the coronavirus, but for that to materialize may take a little bit of time. And we really don't even know whether we will even require that at some point of time in this epidemic or not. But as of now, like you said, sir, just a watchful expectancy, common sense measures, lot of fluids and hydration, eat healthy, and keep oneself well hydrated and rested.
You mentioned that it's a clinical diagnosis initially, but is there any way we have of proving this diagnosis?
Yes, sir. So as these infections become more and more rampant, it also becomes very important for us to pick up these infections to gear ourselves for preparedness, to make sure that we are dealing with individuals and not unnecessarily expending resources on individuals who do not have this condition. So there are definitely tests which are already being conducted. China is conducting a lot of tests because that has been the epicenter of this epidemic. We know that in India, the National Institute of Virology in Pune has started conducting these tests. And these tests rely on one or more combinations of either just serological diagnosis, meaning measuring the antibodies against this disease in the blood, to probably directly measuring the amount of DNA or RNA that is present from these viruses in the blood. Having said that, we will generally tend to use these tests in the more seriously ill individuals when they are present to the hospital setting. And they also have epidemiological importance. So when we use these tests, we will come to know whether the infection has arrived in our country, which parts of our country, and therefore we can deploy our resources, medical resources and human resources, to these areas so that we do not wastefully expend these resources in places that do not require them.
So at the moment, we have a very limited battery of tests that we can use to diagnose it, and we want to reserve it for the sickest individuals. So when we had the H1N1 outbreak, we used to divide patients into 3 groups. Those who were the mildest were treated at home symptomatically, and we did not test them. People who were sicker, we would test, but we would manage them at home. And only the sickest of all, as assessed by the doctor, would go into the hospital, get tested, and get treated as an inpatient. So are we following the same thing for the coronavirus, the novel coronavirus too?
Exactly, sir. We are still triaging them into groups A, B, and C, like you just mentioned, A being the mildest and C being the sickest. And we treat them accordingly. Also, we should understand that it's a fluid time in terms of the information that is disseminated over the vast numbers of information dissemination sources that we have: social media, WhatsApp, Facebook, etc. And because of the general levels of panic, anxiety, and because of the huge numbers of messages and news sources, which sometimes can be reliable but many times may be unreliable, there will be a general tendency among people to either rush to the hospital in a panic for minor symptoms, or on the converse, avoid hospitals thinking it may be a place where I can pick up this condition. I think still our common sense advice tells us that if you think you have any condition, not just related to a coronavirus, do not avoid a hospital. If you think you have a problem which requires medical help and assistance, do not unnecessarily panic thinking that you need to avoid the hospital or you may pick up coronavirus. At the same time, do not rush to the hospital for minor problems, because most of the time it may be just anxiety playing up because of all these sources of information that have been playing on your mind for the past few weeks or months.
So when we had the H1N1 outbreak, we fairly quickly managed to get a vaccine for the H1N1. Do we have any vaccines for coronavirus yet?
Not yet, sir. But from what I have been following with the industry, they are expecting to probably come out with a vaccine within a time frame of maybe 3 to 6 months. Now, we need to understand several things over here. One is the industry has its limitations. They need the virus in order to be able to produce the vaccine. Australia, some researchers in Australia have just managed to recreate the entire virus within a matter of 72 hours of receiving the original genome from the Chinese authorities. That's a good first step in development of the vaccine. But at the same time, the limitation of the industry is that when they initially start producing this vaccine, it may be small in numbers, and therefore we need to reserve these vaccines for the special groups that I particularly mentioned. And if at all this epidemic expands and starts involving very large numbers of the population, wherein we think we will require this vaccine over a very long term or in very large numbers, then we can expect the vaccine numbers to improve over a period of anywhere between the next 1 year to 2 years.
So basically, there'll be a problem of scaling up production and getting it to reach all the populations.
Exactly.
And that's going to be quite a challenge. However, I think we need not worry too much. It's not at that stage yet where, everybody needs to worry. If you have cold symptoms, it's still most likely to be an ordinary common cold and not the coronavirus. Most of these symptoms occur in the general population all the time. So don't panic thinking you have a coronavirus. Is that right?
That's absolutely right, sir. Let me just put that in perspective for you. The number of deaths that have been caused this year with the seasonal influenza and the H1N1 influenza far exceed the number of deaths which have been caused so far in this coronavirus epidemic. Therefore, flu is still a priority. And flu is something for which we have a readily available vaccine. So if you haven't obtained it yet, it's a good time now to probably go and give yourself a flu shot. Give all members of your family a flu shot, especially the young children, the very elderly, the individuals who have special health conditions such as diabetes or transplants, etc.
And in fact, anybody with a severe organ disease, COPD, chronic liver disease, chronic kidney disease, all these people should be especially protected. But it's worth taking the influenza vaccine because, as Dr. Ravi Chandra told you, this is a very common virus. It has been in the population now for the last 11 years to 12 years, and a good, effective, safe vaccine is available to prevent influenza, including H1N1. It's been great. We would welcome questions. You're most welcome to post questions on this group, which Dr. Ravi Chandra and I will be willing to answer. So keep your questions coming and spread the message that this is not yet anything like an epidemic or even a pandemic. And we needn't worry too much about it, but we need to take sensible precautions. Cover your face when you're coughing. Use a mask if you have respiratory symptoms and are going out in public to protect others and to protect yourself. Use a hand sanitizer regularly, especially when you're going out in public or even at home. Wash your hands regularly and be sensible in your diet and exercise and don't smoke. Thank you.
Thank you.